You wake up in the morning, look in the mirror, and one of your eyes is red like it is filled with blood. You start wondering if you're about to lose your vision or if you need to rush to the emergency room. The truth is that in many cases this dramatic red patch on the white of the eye is something called a subconjunctival hemorrhage, and it usually looks a lot worse than it really is. In this video, we are going to break down subconjunctival hemorrhage, which is the medical term for that sudden bright red spot on the white part of your eye. Think of it as a tiny bruise on the surface of the eye, except instead of being on your skin, it is trapped under the clear layer that covers the white of the eye. We will walk through what it is, what it feels like, what causes it, how your eye doctor checks it, when you should worry, and what you can do about it. Let us start with what you actually see and feel. A subconjunctival hemorrhage usually shows up as a sharply outlined red patch on the white of your eye, often on the lower or outer part. The white part is called the sclera, and the clear layer on top is the conjunctiva, and the blood sits between those two layers. Most people notice it suddenly, often when looking in the mirror or when someone else points it out, because there is usually no pain. Your vision stays the same and there is no pus or thick discharge. That is one big clue that this is not a typical eye infection. You might feel a very mild scratchy or a mild pressure sensation, but many people feel nothing at all. The size of the red area can range from a tiny red dot to a large patch that seems to cover most of the white part of the eye. Over the next days, the color can slowly change from bright red to darker red, then to brown, and finally to yellow, just like a bruise fading on your skin before it clears completely. So why does this happen? Inside the clear covering of your eye there are many tiny, delicate blood vessels. If one of these breaks, a small amount of blood leaks out and spreads under the clear layer, which is why you see such a bright red patch. In younger people, one of the most common causes is minor trauma. That could mean rubbing your eyes hard, getting poked in the eye while playing sports, or having trouble inserting or removing contact lenses. Even a small scratch from a fingernail or a contact lens edge can be enough to break one of those fragile blood vessels. In older adults, medical conditions are often more important. High blood pressure, diabetes, and hardening of the arteries can all make these small blood vessels more fragile and more likely to break. Some people are also taking blood thinners or antiplatelet medications, like aspirin or warfarin, which make bleeding easier and can lead to recurring red patches on the eye with very minor triggers. There is also a group of causes related to a sudden increase in pressure in the veins in your head and neck. A hard coughing fit, heavy lifting, vomiting, straining on the toilet, or a very strong sneeze can all raise the pressure briefly and cause a little blood vessel in the eye to pop. In a small number of people, repeated subconjunctival hemorrhages can be linked to blood clotting problems, serious infections, eye tumors, or other systemic diseases, which is why patterns of frequent recurrences should not be ignored. When you see an eye doctor or your primary care doctor, the first step is usually a careful history and a quick but detailed eye exam. The doctor will ask when you notice the redness, if you had any recent injuries, coughing or vomiting episodes, if you wear contact lenses, and what medications or blood thinners you take. They will then look at your eye with a special microscope light called a slit lamp, which lets them see exactly where the blood is sitting and check that the clear cornea and the inside of the eye look normal. In many cases, no extra testing is needed, especially if this is a one-time event and you are otherwise healthy. For adults, especially in the United States where high blood pressure is common, it is recommended to have your blood pressure checked, because subconjunctival hemorrhage can sometimes be the first hint that your blood pressure is too high. If the red patches keep coming back, do not clear in 2 or 3 weeks, or are associated with other bleeding or bruising, your doctor may order blood tests to look for clotting disorders or blood diseases. There are certain red flag situations where you should seek urgent care rather than waiting. If the red eye comes with real pain, vision loss, sensitivity to light, a lot of swelling, or follows a serious eye or head injury, you should be evaluated in an emergency setting as soon as possible, because there might be more than a simple subconjunctival hemorrhage. The good news is that in most cases no specific treatment is needed. A subconjunctival hemorrhage is usually a self-healing condition. Your body will naturally break down and absorb the trapped blood over time. Most small hemorrhages clear in about 1 to 2 weeks, and larger ones may take up to 3 weeks to fade completely. During this time, the color changes you see are normal and do not mean things are getting worse. While the eye is healing, artificial tears can be used if your eye feels a little dry or irritated, and it is a good idea to avoid rubbing the eye so you do not cause new bleeding. If you wear contact lenses, many doctors recommend switching to glasses until the redness resolves and the surface has fully recovered, especially if the hemorrhage was related to lens handling. There is no widely accepted eye drop or medicine that reliably makes the blood go away faster in everyday practice. The more important part of treatment is addressing any underlying issue. That means working with your doctor to control blood pressure, blood sugar, or cholesterol, and reviewing your blood thinner doses if you and your doctor think they might be contributing to frequent episodes. If your subconjunctival hemorrhages keep coming back, your doctor may coordinate care with a hematologist, which is a blood specialist, to rule out clotting problems or blood disorders. The key idea is that a single red patch that slowly fades is usually harmless, but repeated or severe ones deserve a closer look. Thank you for watching. We hope you learned something new today, and we hope to see you in the next video.